Hello challengers, Dr. Naveen here. So this is match the following type of question from radiology, or to be more precise, it is from radiotherapy. So we are looking at the unit of radiation in column A, and in column B we are looking at the parameters which is measured. So they have given units rad, rem, Roentgen, Curie, and also the parameter is exposure of radiation, absorbed dose, radioactivity, or dose equivalent. So we'll look into the details of what we call it as very important topic from radiology or radiotherapy, that is radiation dosimetry. Have you heard of this? The logic is simple. Metry means measurement. So how to measure radiation dose? So we'll also call this topic as units of radiation. See, whenever an exam is asked from this topic, we might think that this question is simple. But as far as my experience is concerned, I had seen many students doing mistakes in this segment because it's more of memory and also a bit conceptual. Looks simple, but we might commit mistakes, and if you don't revise just before the exam, it will be like very tough to do this question correct. So let's see, instead of by hearting all this stuff or memorizing it, let's try to understand the concept behind this exposure and activity, right? So we are looking at the units of radiation measurement. So when you want to measure the units of radiation, what is that you measure? There are two phenomenon or two things that are actually measured. One is activity is measured, and the other parameter is exposure. So we'll start it from here. So what are the two phenomenon? Activity and exposure. For example, there is a block of uranium in your room, and this is U. Okay, so this U is not U, this is uranium, and this here is U sitting in this room. This uranium itself, this uranium-235, this isotope itself will be emitting some radiation. Okay, some radiation. So usually the radiation may be in the form of, there are different types of radiation. It can be an X-ray, it can be a proton, it can be a neutron, it can also be alpha particles or alpha radiation. So these are the different types of radiations which are ionizing radiations. And now here you are. For example, if this uranium emits about 100 units of radiation, I am not naming them, I am just telling that it is emitting 100 units of radiation. You are not going to take all these 100 units, right? You are not going to get exposed to all these 100 units. There is limited amount of radiation to which you are getting exposed. If I want to measure the activity of uranium as a whole, I am looking at the total amount of radiation which is emitted by this uranium isotope, okay, per kg. So this is radioactivity. Radioactivity is measured. There are two kinds of units for measurement. One is SI unit and other is non-SI unit. Let me tell you, actually non-SI units are most commonly used. So what is the non-SI unit of radioactivity? Radioactivity non-SI unit is Curie. And what is the SI unit of radioactivity? Very important. This is becquerel. So what is the conversion parameter? 1 Curie or Ci is equal to 3.7 into 10 to the power of 10 becquerel. Hope you're getting my point. So this is 1 Curie is equal to 3.7 into 10 to the power of 10 becquerel. So we are done with the radiation activity. Now let's come back to the exposure part. Before doing that, here radioactivity is 4. Radioactivity is measured. The old unit is Curie and the new unit is becquerel. Next thing what we are trying to measure here is exposure. So the amount of radiation to which your body surface got exposed is exposure. So this exposure as a whole in general is measured both again by SI and non-SI units, The SI unit of exposure is Coulomb per kg, and non-SI unit is Roentgen. Roentgen is the one which is commonly used, that is Roentgen. This is about exposure. So where is this radiation exposure? So radiation exposure is Roentgen. So here option 3 is A, option 4 is matching with C. Okay, so probably by looking at these two options, option 1 should be the correct answer, but we'll look into that. Now after understanding this, let's take a clinical scenario to understand further what are the different types of exposures which we measure. Okay, so radiation exposure is not simply expressed with the help of Coulomb per kg or Roentgen. This is a core parameter, but overall it is expressed in several ways to account for different levels of harm. So when I say harm, let me get back to the core again. For example, let's say the exposure is actually measured in 3 ways. Absorbed dose, equivalent dose, and third parameter is effective dose. Please remember this. What are these 3? Absorbed dose, equivalent dose, and effective dose. Exposure or Coulomb per kg is a general term. You are not taking anything into account. But let's come back to the same example which we are discussing. This is uranium, and this is you getting exposed to the uranium radiation. Okay, so with this uranium you might have a chance of getting exposed to, for example, 100 Coulomb per kg, the overall parameter. But how much amount of exposed radiation you are getting absorbed? So how much amount of exposed radiation is entering into your body is absorbed dose. So it is the total amount of radiation delivered per unit volume of organ, that is kg. So this is the amount of energy you are getting absorbed. So how do you measure absorbed dose in general? Absorbed dose, we have an SI unit. SI unit of absorbed dose is Gray, and non-SI unit is Rad. So how to remember this? Do you know ABG, arterial blood gas analysis? So absorbed dose, whatever you see, is actually Gray. Okay, and you can do it as ABG reading. So AB means absorbed dose, G means Gray, and R is Rad. Please remember this mnemonic. Now absorbed dose is done. For example, you are absorbing 1 Gray of radiation. So your body organ per kg is taking up 1 Gray of radiation. The conversion factor here is 1 Gray is equal to 100 rads. So it goes without saying 1 rad is equal to 0.01 Gray. Okay, they might not ask questions on this, but it is important for you to know. 1 Gray is equal to 100 rads and 1 rad is equal to 0.01 Gray. So here absorbed dose in this question B, absorbed dose is measured in non-SI units, that is rad. So option 1, the answer is B. So we are left with 2. We'll come back to that. So please remember these 3 parameters. So let me revise again. We have covered activity so far, then we have covered exposure, and then we have covered absorbed dose. Now we have 2 important parameters again. One is equivalent dose and the other is effective dose. From the previous discussion, I told you absorbed dose is like this much amount of radiation is getting absorbed into your body. In this, we are not considering 2 factors. For example, there was one question which is asking you what is the safe amount of radiation a pregnant woman can get exposed? When I ask you that, you cannot define it in the terms of absorbed dose, because the next question comes is, which type of radiation you are talking about? Which type of radiation? For example, we have X-rays, we have gamma rays, we have even electrons, we also have proton radiation, we also have neutron radiation, and also alpha radiation. It goes without saying, these different types of radiation cause different amounts of biological damage. Alpha radiation is more dangerous than X-rays. And to define this dangerousness, to define this biological damage, you cannot just use a term called 100 gray, because 100 gray is neither telling you about which type of radiation it is, and also this 100 gray is not giving you details about which organ is actually getting affected. For example, different cancers respond differently with different radiations, right? The different dose. Uterus and vagina are radio resistant. Even if you increase the exposure rate, the organ will not die, the cells in the organ will not die. So one more parameter which actually affects whole of the dynamics is the radiation sensitivity. So what I'm trying to cover here is radiation sensitivity of an organ. So there are two parameters which needs a special mention, that is type of radiation and also radiation sensitivity of an organ. And these two parameters are not taken into account when we are actually looking at absorbed dose. And these two parameters are taken into account when we are looking at equivalent dose and effective dose. Equivalent dose takes into account the type of radiation, and we call this factor as radiation weighing factor. Don't get confused, I'll come back to what it is, but when you hear about equivalent dose, think of radiation weighing factor or WR. What is this radiation factor? Let me tell you. For example, your body is getting exposed to 100 gray of radiation into what type of radiation it is. For example, if it is X or gamma or electron, the radiation weighing factor is 1. So you put it as 1, you will get a value of 100. If it is proton, the radiation weighing factor which is determined for a proton is 2. You have to multiply this exposure with 2. You are getting 200. I'll come back to the unit. Next is neutron. Neutron has a radiation weighing factor 10 and alpha has highest, that it is 20. So the value becomes 100 into 10, that is 1000, and also 100 into 20, that is 2000. Here, with the help of type of radiation and its weighing factor, I am actually looking at an equivalent dose. That is, it is a measure of biological damage that can cause to a body or an organ. So it is absorbed dose and also effectiveness of the type of radiation. Now this unit is, whatever I am discussing, this unit is, SI unit is Sievert and non-SI unit is Rem. For the same amount of exposed dose, the equivalent dose is different. Equivalent dose depends upon which type of radiation you are using. So this is 100 Sievert for the first case, 200 Sievert for the proton case, 1000 Sievert for the neutron, and alpha radiation is dangerous. It is almost giving you an equivalent dose of 2000. So you are calculating a relative value. Now tell me, alpha radiation is more dangerous at the same exposed rate in comparison to the X-rays, right? So of late there is a trend of asking questions in sequential arrangement manner. If they give all these parameters and if they want to ask you that 100 gray radiation is exposed to the body, based on the type of radiation, arrange the following in an ascending order. So you have to choose X-ray, gamma, electron over proton and proton over neutron, and finally comes alpha radiation. Okay, so let me come back to the question again, then we'll go into the effective dose. Here I am only looking at equivalent dose, and equivalent dose SI unit is sievert and non-SI unit is Rem. So what is the final answer? Option 1 is B, option 2 is D, option 3 is A, and option 4 is C. So we're done with this, and you know the conversion rates. 1 curie is equal to 3.7 into 10 to the power of 10 becquerel, 1 gray is equal to 100 rads. Similarly, 1 sievert is equal to 100 Rem. Oof. So we're done with radioactivity, exposure, observed dose, and also equivalent dose. Now we are left with one more parameter. So let me go back into the next slide. See here. Till now we discussed so many different doses, but what is this new one called effective dose? In the equivalent dose, we are taking into consideration the type of radiation. But for example, if there is a 100 sievert equivalent dose is falling on bone marrow, and 100 sievert equivalent dose is falling on uterus. We all know uterus is a radio-resistant organ like vagina. Bone marrow and blood cells are highly radio-sensitive. For example, 100 sieverts of equivalent dose can actually damage bone marrow rather than uterus, because uterus is radio-resistant. But we don't know how much damage it causes. Okay, so effective dose also takes into account the radio-sensitive nature of an organ. So we call this factor as tissue weighing factor. Similar to the radiation weighing factor, this is tissue weighing factor. We multiply equivalent dose with the tissue weighing factor, you will get effective dose. It's as simple as that. So can I say the risk of carcinogenesis, the risk of genetic defects is better measured by effective dose. And also, when I want to give you a statement that PET-CT is more harmful to the body than chest radiogram, I need to look at the typical effective dose. For example, PET-CT is giving you an effective dose of 25 millisieverts. We are considering a whole body effective dose, whereas chest radiograph has an effective dose of only 0.02. So when given an option, you always need to choose chest radiograph over the PET-CT, because PET-CT has more effective dose and this can cause more harm to the body. So this is how you calculate effective dose. But don't worry, similar to equivalent dose, effective dose also has the same SI unit, that is sievert, or the same non-SI unit, that is Rem. So you are saved here. Okay, that's the reason in the match the following we haven't given you, we haven't asked you the units of effective dose. So with this, hope you got a general idea about like what are the different units of radiation or radiation dosimetry. Now, meanwhile, we also need to understand the typical effective dose of different diagnostic procedures, because sometimes what happens, they might ask a question in the ascending order of which is least harmful, which is most harmful when it comes to the investigation, that is diagnostic perspective. So you also need to please take a look at this table and try to understand it. One thing is clear, PET-CT is more harmful, and chest radiograph or X-ray of the femur and all, they take less radiation. And next thing, because as I told you, the effective dose is taking into consideration the radio sensitivity of the tumors and also the organs. Let me give you the details of these. So we have highly radiosensitive tumors. I read it in Orthopedics. Maheshwar is saying that Ewing's sarcoma, it melts like an ice. It melts. This is the dictum word they give. It melts like an ice with radiation. Similarly, seminoma also has been given a characteristic representation in Bailey and Love. Seminoma also melts like an ice with radiation. And we also know lymph nodes, bone marrow, blood cells, they are most radiosensitive. That's the reason myeloma is there, and also Wilms tumor is a bit radiosensitive. But highly radioresistant, please remember melanoma and osteosarcoma, because there were questions in the previous year from this. And even RCC, hepatic carcinoma and pancreatic carcinoma are also highly radioresistant. So when it comes to the organs, most sensitive tissue, from tissue point of view, bone marrow and gonads are most radiosensitive, whereas nervous tissue and muscle fibers are least sensitive. When they ask you about specifically about blood cell, lymphocyte is most radiosensitive, platelet is least radiosensitive. When they ask about stages of cell cycle, which phase of cell cycle is most radiosensitive, it is G2M. And which cycle is least radiosensitive, very important, okay, S phase. G2M interphase, in between G2 phase to M phase we have an interphase, right? So that phase is most radiosensitive. Different cell types, rapidly dividing cells are most radiosensitive, whereas quiescent cells are least radiosensitive. When it comes to eye, inside the eye, lens is most radiosensitive, and also sclera is least radiosensitive. And if they ask you specifically about different layers of retina, rods are more radiosensitive, ganglion cell layer is least radiosensitive. When it comes to abdominal organs, kidney is most radiosensitive, whereas vagina is most radioresistant. And most common organ affected by radiation is skin, okay. And which layer of skin is most commonly affected by radiation? It is stratum basalis. So this single slide, single discussion of 1 minute has almost 10 to 20 important MCQs here, okay. So please do revise this part also. And finally, before closing this, the NEET PG 2020, they have asked a question on TLD badge, also known as thermoluminescent dosimeter. During my after MBBS, I used to work as a medical officer before joining PG. I used to work for an year in this setup, in a nuclear medicine setup, PET CT center, wherein I used to take care of cancer patients and all. I used to wear a badge called TLD badge there. So what is this TLD badge? It's a thermoluminescent dosimeter badge. So the same spotter was asked in NEET PG 2020, asking about what kind of instrument it is, why it is used and all. Okay, there are two kinds. One is body worn to a shirt, that is to the chest, and other is wristband, which is worn to the wrist. Okay, there are two types there. So as per the Radiation Protection Rules 2014, all occupational radiation workers, they need to be monitored, so that you need to calculate the absorbed dose regularly, because they will be constantly getting exposed to the ionizing radiations, right? And inside this badge you will have 3 radiation TLD discs. Okay, there will be 3 discs inside it, and they should be body worn or wrist worn, and they should be sent for analysis every month. So each month they used to ask us to return the badge. So whenever our badge returning time is in due, we used to get a new badge again. Okay, that is a replacement TLD will be given. After that, our used badge is taken and it is sent for lab to check the reading. So in this way, the radiation is monitored continuously. Okay, and there is a tolerable limit. Okay, the maximum allowable dose in 1 year, the maximum allowable dose, this can be an MCQ, is 30 millisieverts. So look at the importance of sieverts. This is effective dose. You can get exposed to 30 millisieverts if you are a occupational worker. Okay, and in total 5 years, your radiation dose should never exceed more than 100 millisieverts. So in a given 1 year, don't make sure that it is not over 30. If it is over 30, you have to take a break. That's it. Okay, you have to take a long leave and come back again. So even if the person is using lead aprons, we know, right, some of the technicians, they come into an X-ray room with a lead apron. Even if they wear lead apron, they should make sure that they wear the TLD badge inside the lead apron, not outside the lead apron. And the TLD badges are always named. There is a name written on them. So they should not be used interchangeably. Okay, it's a common sense, but just I'm covering a point here because they might ask a question saying, because last year in EPG 2020 they asked a question, what is this? What does it do? In the next, they might ask you which of the following is a wrong statement, interchangeably used, two types are available, the maximum tolerable dose is this. So these kind of questions can be asked. Okay, so this will conclude our discussion on an important topic, that is units of radiation or radiation dosimetry with the help of an MCQ. So I tried to cover the effective doses of different procedures, what is TLD badge, and what are radiosensitive and radioresistant tumors, and very importantly various MCQs in the field of most radiosensitive to least radiosensitive. Okay, so thanks for listening.